Yes.
Yeah, I agree wholeheartedly. I think you, as you said, we could truly call it a mental health epidemic, which is, has been something that's been growing for many, many years. And again, we've had these, some pretty distinct exacerbations of the problem.
Mhm.
And I think that, any resources that, can be used to bring more attention and more visibility to it is I think is certainly something that's beneficial on the whole.
Barbara, any thoughts?
I would agree. I'm curious as to who the community leaders would be that we would reach out to and how we might do that. And that's
Well,
part of the plan.
certainly the community board has a way of reaching out to the community. It sends out regular updates or invites. There's part of the training specifically focuses on faith leaders, so that's something else we could work with. There's an interfaith group here. I know in Riverdale and Kingsbridge, perhaps some of the other groups that we can reach out to. And then, you know, just getting the word out there, working perhaps with some of the local press and Facebook or other kinds of opportunities. Ms. Rabner, what's your, you want me to call you, what's your first name? So I can, or how do you want me to address you?
My name is Miriam Rabner. Miriam is.
Miriam, okay, Miriam.
Okay.
Any thoughts about that from even, I mean, you deal with MJHS, I know that the primary population you deal with is sort of a senior population, correct?
Yes, but you know, mental health, I've been working for the past 20 years in hospice care, and mental health creeps up across all generations. It's not defined to older people or younger people, and there is still this tremendous stigma around it in the community. And when there are group homes for people who are mentally challenged or emotionally challenged, nobody wants them in the neighborhood. And I think showing how we can be supportive and that there is no need to be fearful, and on the contrary, ways to engage, and also show them what kind of professional support is available and how to reach out if we observe something or we feel somebody is suffering emotionally and mentally. I think that might be very helpful.
Excellent. So what I'm gonna do with your permission is reach out to Dr. Zhu and see how we can turn to her staff and see what kind of training. And then I'll speak to the staff here at the community board to see how we can, as you reached out, as you asked about outreach, Barbara, is how do we do outreach and how can we get the information out to folks? And I imagine an early evening would probably be best for most.
Yeah.
Yeah,
I think so.
so I will find out about that. And so that's an important thing I think we can do. As I said before, we cannot vote on the committee minutes because we don't have a quorum. I think we would have to have another person in the room, which we don't have. It's like I said, it's a little cold out there. And I understand, by the way, from overall, that they've been having trouble for people turning out to committee meetings. Some committees tend to get full meetings. I understand public safety, they have interesting stuff like liquor licenses and, you know, this is a less sexy, so to speak, committee. So we'll have to try and make sure that people turn out as best as we can. My chairperson's report was really about what happened in our last committee meeting. And again, perhaps our next slot, I'll speak to Dr. Zhou and find out if maybe our next slot, I don't know the date, I have to find out from the folks here in the office, but I'll get some dates out of the office for March, and we'll see if we can do that. I will be coming into some, I was telling Wayne before that I've been selected recently as a member of the Interfaith Advisory Committee for Northwell Health. to be in a fellowship, a 13-week fellowship, matter of fact, on mental health and trauma, and for the faith community. So I think I'm going to be running into a few folks that we can call upon, and I know that the Northwell system has been extremely open to doing just this kind of outreach. One of the big areas, by the way, just that Northwell deals with, and particularly from a mental health point of view, is gun violence. I've had a long history of working with it's some of the administrators there, and they have really dedicated themselves to gun violence, and they look at it through the lens of a mental health issue and a societal health issue. They don't look at it through the lens of gun control. And basically they look at it through basically 4 different pockets or buckets. One bucket is, of course, what we all hear about in the media is the mass shootings. And that's actually the least number of people that suffer from gun violence. The next bucket is the kinds of local type of shootings. Again, we hear about, particularly young men that decide shooting somebody is a way of solving a problem. And again, it's horrific, but is again lower numbers as we go down the list. So it says the buckets. As we reach the highest number, the second highest number are domestic violence, use of guns and domestic violence, again, a mental health issue. However, the largest number of gun violence is through suicide. And it's over 50% of all the gun violence in our country is through suicide. And it's something a lot of people don't know, but it's really something that the president or the CEO of Northwell, Michael Dowling, talks about on a pretty regular basis. And he speaks very passionately about it too. He's really dedicated his system to work on these issues. So perhaps it's something else we could take a look at. One thing I'd like to approach, and I need to approach because like I said, they'll give me a hard time when I go back to the main board, is our FY 27 capital and expense budget priorities.
Yeah.
I know that last year, it was around COVID. It's my understanding, and I sit on the board of NYU Langone FQHC, and in our last briefing, God bless.
Thank you.
Bless you.
With our director of medicine, COVID is something that is still very present in our society, however, under much better control. Certainly through screenings and through vaccines. We'll see what happens in Washington about vaccines. It's such a peculiar thing. However, some of the other ideas, of course, that came about was, and let me just find the sheet. 1 second. Here. One was provide funding for its course for COVID. Another one was around domestic violence, the NYPD. I don't remember voting on that, but I guess that made it in there somewhere. And the last budget item, this was in FY 26. That was FY 25. I just spoke about. That's a recommendation for FY was. Again, counseling services for COVID and counseling services for domestic violence and protective medical supplies. I'd like to put something on the table, and it's something that affects the Bronx as it affects our entire country, but it protects the Bronx in very, very deep ways. Is again. Those who are, and it's something I heard very dramatically today, there are children in schools today who are themselves either undocumented or children of undocumented parents, because they may be born here in this country, who are going through a tremendous amount of trauma because of what's happening on a national level. Again, I don't want to take a political stand. I have my political stand on it. However, these children are under deep trauma because they themselves are fearful of being deported, or their parents or family members being deported. And there's some narratives, children in schools afraid to go to school because they're afraid that their parents will not be there at the end of the day when they go home. That has, of course, not happened yet. It could happen at any time. So I was wondering if it's something that we might want to make a recommendation around, is counseling services for school-based mental health, particularly for children who are affected by some of the actions around migrants in our country. I'd just like to get some of your feedback on that concept.
I think that would be a great idea. I don't know the extent of the issue, and it's a catch-22. Because if the kids don't go to school, that's documented. And then at a certain point, it's sent to ACS,
Right,
for child neglect, educational neglect.
right.
And
Right.
that's documented, and then they're flagged. So it's a catch-22.
It's a horrific thing. So I think a lot of the information that's coming out is really anecdotal.
Yes,
But however, I can only imagine that this has become, is a very real thing. That students and their families have real levels of fear and would need culturally competent, linguistically competent counseling. Because many of them obviously are not English speaking. The children may be, but the parents are not. So are not English speakers. So Wayne, any thoughts about that?
I agree. I think there's not, like you said, not only anecdotal, which a lot of it is, but I mean, you know, there is a lot of evidence that the sort of larger factors that are outside the classroom can certainly have a significant impact on students' ability to function and learn. And there is evidence that even if it is not mentioned out loud, that these young children are capable of processing sort of what's happening in the atmosphere and are aware, and it certainly can have an impact on them. But I think the only concern I would have, given, again, not political, given the atmosphere that we're in, is I think it would be important that we word it properly. Because again, we're also dealing with let's call spade a spade. We're dealing with a double push that anything that even remotely mentions topics that are not approved is subject to pushback. And so it may just simply have to be worded as counseling services for student needs. Because I would hate to implement something and then it immediately get walled off, and therefore it is
Right,
of no
that's
utility.
true, that's true. We don't know how, right now, I know that at this point in time, the governor has pledged to maintain services. The mayor has not said anything whether yay or nay, although there were trainings, just to let you know, there were trainings this week in schools across the city and formation of local teams. I did get to see some of the materials on how to handle should ICE show up at the schools, how they're going to handle it, and who they need to call, and what are the various different types of subpoenas that people may show up. There's several different kinds. It's just really, I think people are looking over past I was again speaking to someone in the Asian community today. They're looking over past protocols, they're looking over possibilities. But I think that you're right. Maybe we have a more blanket type of suggestion that provide mental health services for children in schools. And a large number of children in schools here in the Bronx are from immigrant families. The children themselves immigrants or children of immigrants. So I think that would be incredibly helpful. Again, I spoke to a good friend of mine, a sheikh, from, Gambia, who says in the African community here, it's just deep seated fear, deep seated fear. I will be speaking to folks in the DOE next week. I'm on, I get to do a lot of things, because I get bored real quick. I sit on the Interfaith Advisory Committee for the Chancellor, and we're having a meeting around this issue next week, so I will bring it up and see what type of services they're providing, or if they can provide some language for us that would be, acceptable. And I will, I will come back to you and suggest some language. You don't have to vote on it. We can't vote on it tonight, but we have to get some suggestions to them by at least, I believe, the board meeting next month. So we, God willing, will move forward on that. It would be nice if we didn't have to think about those things, or those kids didn't have to think about what the possibilities are, but it's the world we're living in right now.
Yeah.
No ifs, ands, or buts. Let me see what else we have. So, old business. Old business is we need and again, we don't have a lot of folks from the committee, but we need a co-chair. I've been told by Julia Reyes, our chairperson, that I need a co-chair. The person who was the co-chair last year is no longer on the committee. So if anyone is interested in being a co-chair, now what that means is that should I not be available, I've generally been available, one would have to step in and chair the committee meetings. We have committee meetings, I think every other month. It's not a monthly thing, but we have committee meetings every other month. So if people are either a member of the committee, both Barbara and Wayne, are interested in being a co-chair, let me know. I would deeply appreciate it. And I'm just wondering if there's any new business. Any new thoughts? I know actually this is the whole question around the migrant issue is part of our new business as well, and how that's going to affect part of our mandate is social services, how that's going to affect social services here in the Bronx,
I agree. I think, I think not only that, but again, when you do consider that, a lot of the edicts, and change in policy will affect a lot of marginalized populations.
Oh, yeah.
And, in ways that I don't think have been seen in decades. It may come to that there may be much more for this committee this committee to help in. I mean, when you think about Myriad, Legion, at this point, so and maybe thinking about how I think the needs of the community at large, but also looking at our specific populations in this area, so we can maybe start thinking about try to anticipate what needs might be coming down the pipe.
That's very important. Just off the top of my head, I know I sit on the compliance committee of an FQHC, Federally Qualified Healthcare Center, and one of the things we're constantly looking at is percentages of children that are vaccinated or screened. And if children are, or if their parents are afraid to go to any center, because as you may know, just yesterday, the rule about sensitive sites was changed. What that means is that up until yesterday, according to federal statute, that sites such as hospitals, houses of worship, hospitals, houses of worship, and there was a few other sites, but
Schools, I think.
Schools, schools, were considered sort of sacred. That there would not be raids in these places. That was removed yesterday. And by the way, that sent the entire migrant protection world into a real, not only a funk, but a real tizzy. They really are trying to figure out what that means. That's one of the reasons that the DOE is doing these kinds of trainings. So let's say, you know, it's the kid needs, X amount of, screenings or, you know, the kinds of interventions that will make sure that, they're not, their weight's under control, so they're not getting diabetes, and that's a, you know, it's a childhood scourge nowadays. And if the kids are afraid to go to, or the families are afraid to go to their regular appointments because they're afraid there can be an ICE raid, that means that there'll be even worse healthcare results here in the borough. By the way, as you know, the Bronx is 52 out of 52. We have the worst healthcare results in the entire state. Just, I'm not even sure what to do.
I think one of the things that we might consider discussing is it's overwhelming. It's literally overwhelming. And where do we want to prioritize? I mean, we have migrant children and health, we have and accessing services, we have migrant children in school, undocumented and documented. They still may be afraid to go. And who knows, there are so many. What I think we ought to pick one or two priorities to work on for this year and next. Otherwise, we're all over the place. I don't know. What do you think?
Educate, I think it's a good idea. Education is not our mandate. It's really, it's
Right.
healthcare. I certainly would be more than willing to reach out to the education committee and see how they're approaching this. I believe that's youth and education's Ramdot.
Yes.
So I reach out to Ramdot and find out what he has to say. He was part of one of the fellowships that we ran, and I know that he's been very responsive to these kinds of issues. I would focus on healthcare and the impact on healthcare and mental health. And you know, so that would be obviously we're going to make we'll examine or try and get the right language for funding for mental health for school age children. And I would also focus in on the issue of access to healthcare, and how the migrant problem and the threat of deportation is going to affect the healthcare of so many of those living, I'm sure, in our community board and Bronx wide, certainly citywide as well.
Absolutely.
Perhaps I could reach out to someone in the migrant movement that is dealing with the healthcare issue, and maybe they could speak to us next time we meet as well. I will take a look.
Would be good.
Yeah, I'll take a look at that. Yeah. So we are now 35 minutes into our meeting, and we've gone through some pretty heavy duty stuff in a relatively short period of time. If there's nothing new, we can't even vote on adjourning, but we can say keep warm.
I wanted to add something, if I may, Rabbi Kaplan. Under mental health, would you consider reaching out when we have the training to the veteran population as well?
Oh, absolutely, 100%. Yeah.
And
So-
LGBTQ community is also being threatened and marginalized and traumatized, and again under tremendous attack. And there is a huge sense of depression and abandonment, for lack of a better word. And so maybe we can appeal to a larger circle because so many people are suffering right now.
That's really an excellent observation. I think that what we're experiencing around it right now is a little overwhelming and mind numbing, and maybe we were not even seeing the extent of how it's reaching into a lot of different populations, as you just mentioned, the LGBTQ community, people who are in transition, people who are, who have gone through transition, who are now, legally, from a federal point of view, they've been more than marginalized. They've been, well, from some cases, their status has been eliminated now.
Yeah,
It's just, it's like, it's just. I didn't deal with something like that. It's like, you know, it's still on most forums how you identify, I'm hoping that within our city and state that those will remain the same and they will not be marginalized or eliminated. Or the word that people are using, erased, within New York State, but certainly on a federal level, that is now, you know, mandated. So, I can't even begin to imagine. Cannot even begin to imagine, but thank you, Miriam, for the suggestion. Really appreciate it. Wow, stunning.
it's, yeah, that's there's no words. Really no words, and it's. It'd be, if it were one domain, it'd be frustrating but manageable, but it really is coming from everywhere, all at once.
It's I will give you one word of encouragement, though. As you know, I'm also one of the, again, I get to do a lot of things. I'm also one of the commissioners of human rights in New York. And I was speaking to the deputy commissioner, number 2 person, and this is what she said. Whatever you would, with the elimination of something like DEI, whatever you want to call it, the protection of people according to the categories that have been laid out by this, whether it's racial, sexual preference, age, all the various different categories, is a law in New York State and New York City.
Right.
And they will continue to ensure that those people that fall into these various categories will A, be protected, and should those be violated, they will still move to prosecute. Obviously, that is not going to happen on a federal level, which is again a little strange. Strange is not the right word for it. Devastating, but certainly on a local level in New York State and New York City, these are law. And if people, you know, just want to eliminate the words DEI or whatever words you want to use, and a friend of mine who does a lot of training around DEI is now taking out the words diversity, equity, inclusion from all their grants and replacing it with other similar language, but not using the language that has been eliminated from the federal government. Yeah, just know that there are still people out there doing the right thing. It's
That's
not,
encouraging.
it's not like the whole system collapsed. It's just that, but certainly on a federal level. And I did hear one other encouraging thing today, that at least there's a temporary injunction against the birthright.
Yeah.
Yeah. So, we will move it forward, folks. And thank you for joining us this evening.
Thank you.
Thank you.